Hi guys, we're gonna discuss about the anatomy of the larynx in two parts. In part one, we're gonna talk about the cartilages that make up the framework of the larynx, the ligaments and membranes that connect them together, the laryngeal cavity and its parts, and then we're gonna move on to talk about the muscles, blood supply, innervation, nerve injury, and the basic idea about the histology of the larynx in part two. So, what is larynx? Larynx is actually a musculocartilaginous structure because it is formed of cartilages, muscles that connect them and work on these cartilages, and membranes and ligaments. It's basically a cavity, and that cavity is where you're going to take the air all the way to the respiratory system. You're going to breathe the air in. It comes in from the nose and then to the nasal cavity, and then it goes to the pharynx because you have three parts of the pharynx. So you have the nasopharynx behind the nasal cavity, you have the oropharynx behind the oral cavity, and in oropharynx, it's mixed between the air and the food. And then once you proceed down to the laryngeal pharynx, this is the part that's in front at the back of the larynx, which is the laryngeal pharynx. You need to decide if that is an air, it goes automatically to the respiratory system through the larynx, or you need to swallow a food, and in that case, your epiglottis is going to be notified about the food. It's going to cause the epiglottis to close off and seal off the laryngeal inlet by the contraction of the aryepiglottic muscle. We're going to talk about that later on. And then in that case, once you close off the airway, it means the food is going to go all the way to the muscular structure, which is the esophagus, and then it goes to the digestive system. And that is explained in the digestive module playlist. Normally, the larynx is opened by cartilages, so cartilages cannot be compressed, but thanks to the epiglottis, that's going to seal off that opening whenever we want to swallow a food. So if you guys look at this picture, you have the nasal cavity, you have the nasopharynx at the back of it, and then the oral cavity, and then oropharynx, yes. And then here the larynx, we're going to talk about that. And then the part behind it is basically the laryngeal pharynx. All right, now, what are the cartilages that make the larynx? We have three unpaired cartilages and we have three paired cartilages. The three unpaired ones are the thyroid, the cricoid, and epiglottis. So basically, this is the thyroid. Below that, you have the cricoid. All right, and then you have the epiglottis. So these are the most important cartilages that are forming your larynx. The epiglottis again, and the thyroid, the cricoid, these are the unpaired cartilages. And then you have the three paired ones. The three paired cartilages are basically the arytenoids, and then you have the corniculates on the top of them, they are corn-like. And then you have the cuneiforms, and these are small pieces of cartilages too, and they are embedded in the aryepiglottic fold. So if I have a fold between the arytenoid and the epiglottis here and there, and remember that fold is what covers the aryepiglottic muscle. We just mentioned it, and we said that this is the muscle when it contracts, it brings the epiglottis back, and that seals off the entrance of the larynx. All right. So in that, the cuneiforms, two paired cartilages are embedded in that fold. All right, now let's see what are the structures of the unpaired cartilages. We have the thyroid, all right? So the thyroid is formed of two laminae, right and left. Lamina means something like a layer, and these two laminae will come and fuse together in the center to form the laryngeal prominence. You guys, this is what we call the Adam's apple. It is acute. This angle is basically acute in male. That's why it's more prominent. It's about 90 degrees. And then in female, it's about 120 degrees. It's obtuse angle. So that is fusion of these two laminae will give you the laryngeal prominence. Now, if you look at a side view of the thyroid cartilage, you guys can see that we have a superior horn and inferior horns, right? And that from there, We need to have ligaments that connect the cartilages together, and we're going to talk about them down the road. And then down here we have the cricoid cartilage, and the cricoid cartilage looks like a ring. So basically this is the cricoid, looks like a ring with a broad lamina posteriorly and a small arch anteriorly. So if you guys look at an anterior view, you can see that the anterior small arch is basically the anterior part of your cricoid, and then posteriorly you have a broad posterior lamina. At the end of the day, that will give you the complete ring kind of appearance. So if you guys look at this, this is basically your cricoid cartilage. Now, in the top of this, you have two arytenoids, the two arytenoid cartilages, all right? And then, sorry, let's just finish off talking about the epiglottis. It's a leaf-like cartilage, and this is the last of the three unpaired ones. And thanks to the epiglottis, it's very important as it seals off the laryngeal inlet whenever we want to swallow a food, and this is how it looks like anteriorly. And then moving on to the paired ones, you have two arytenoids, and they are very important when we talk about the vocal cords and the muscles that control phonation and the entrance to the glottis, all right? And then on top of them, you have two corniculate cartilages. They are cone-like, all right? They sit on the top of the arytenoids, and then you have these cuneiform cartilages that are embedded in the Aryepiglottic fold. So if I have Aryepiglottic fold here, it means, all right, it means this is embedded in that, all right? Now, there is important mucosal folds that connect your epiglottis to your tongue, all right? Because this is your oral cavity. Remember, that was your oral cavity here. And remember, at the back, we had the oropharynx, right? And then down, we were moving from the oropharynx to the laryngeal pharynx. It means down here is the start of my larynx. Now, in order for this epiglottis to get attached, it needs to be attached to the surrounding structures. And because my tongue is anteriorly, this is the posterior 1/3 of the tongue, I have folds, mucosal folds, that connect the epiglottis to the tongue. So what do you think that the name of that will be? It's going to be the glossoepiglottic folds. I have two lateral ones. Glosso means tongue, epiglottic because it's epiglottis, right? And I have two lateral ones and one median, and in between them we have something called vallicula. All right, so basically the vallicula, it's something like, it means a depression between elevated areas. So these are what we call the vallicula. All right, so if you guys look at this top view, this is your epiglottis, all right? Here you are in the oropharynx. This is part of the tongue, and then you had the lateral glossoepiglottic folds, right and left, and the median one is there. So what's the depression between them would be the vallicula, all right? And this is the epiglottis without the other structures. Now, look at the paired ones. So remember the paired ones, we already talked about them. We had two arytenoids sitting on the top of the posterior broad lamina of the cricoid cartilage. And this is very important cartilage when we talk about the folds and phonation and the muscles, all right? So arytenoids are very important. They have processes, the ones that are facing your thyroid. This is basically at the posterior side. Thyroid is anteriorly. You guys can touch your laryngeal prominence and make sure that your thyroid is anteriorly, and the arytenoids are posteriorly. If we look from that view, you guys can see that this is the thyroid. It's a cut piece of it, and this is the arytenoids, and it's showing a process, and that process is what gives you the vocal ligaments or vocal cords. And the vocal cords, so that's why we call these as vocal processes, and from there you get the vocal cords attached to the thyroid cartilage anteriorly. So posteriorly you have your arytenoids, anteriorly you have the thyroid. We have also another process which is very important for attachment of muscles laterally. So if you guys look laterally here, you can see muscular processes, and these are going to be for the attachment of the some of the muscles like the arytenoids, oblique and transverse, and other muscles. We're going to talk about them as we proceed. And then you have a facet for articulation with the corniculate, and that is basically on the top. So here, these are the articular facets, and these are the corniculate cartilages, and then the last ones are the cuneiform cartilages, and they don't have a huge significant function to talk about them, right? So the most important cartilages we have here in the larynx, I want you guys to always remember them, because they are going to basically be involved in a lot of important functions in the larynx, which are the thyroid, the epiglottis, the arytenoids, and the cricoid. So remember them, and we're going to talk about them into more details. Now, when we move on, talking about the ligaments and membranes, we already talked about the cartilages, and now we need to connect these cartilages together, and we need to connect them to the surroundings. Now, think about an extrinsic ligament or membranes as the things that they need to connect me as a larynx to the surroundings. Now, think about that. You guys have your hyoid bone on the top, and this bone is very important for the movement of the larynx during deglutition and swallowing. So this is your topmost structure. This is the thing that sits on the top of your larynx. And now after the larynx, what do you think we have? We have the trachea, because we need to take the air to the trachea, and from the trachea to the lungs and breathe. Now, and also you have the epiglottis there, part of your larynx. You have the thyroid, and then you have the cricoid, and these are parts of the larynx. Now, if I have membranes, it means these extrinsic ones, it means these membranes and ligaments, they need to connect my larynx to the surroundings. So if I have a membrane that's going to connect my larynx superiorly, it's going to connect me to the hyoid, and that's going to be between me as a most superior part of me with what comes before me. So the most superior part of me as a larynx is the thyroid cartilage, and what sits on top of me is the hyoid. So that membrane is going to be called the thyrohyoid membrane. Okay, so this is the first membrane as extrinsic membrane. We have it that connects me to the surroundings. Now, what comes next to me is the trachea. And the lowermost structure of me as larynx is the cricoid. So what do you think the name of the ligament is going to be? It's going to be the cricotracheal ligament. So basically, this is the ligament that's going to connect me to the thing that follows me, which is the trachea, and that is the cricotracheal ligament. Now, I have another important cartilage, and that cartilage is actually kind of flying out there, and it needs to be fixed because it comes on top and it keeps on moving, and that needs to be also fixed. So the ligament that's going to fix the epiglottis to the surrounding is going to be called the Hypoebigloric Ligament. So again, we are fixing ourselves as cartilages of larynx to the things that on top of us and below us. And on top we have the hyoid, so we have the thyrohyoid membrane, we have the Hypoebigloric ligament on the top, and then we have the cricotracheal ligament down to connect us as parts of the larynx to the following structure, which is the trachea. Now, moving on to the next, we're going to talk about the intrinsic ligaments and membrane. And in that, we have two important membranes. One comes on the top and one comes down. The one that comes on the top is basically the quadrangular membrane, and what comes down is basically the conus elasticus. Now remember that the thing that comes on the top is basically connecting me to something that's in the top, and what was in the top for me as part of larynx is the epiglottis, and what comes down is basically gonna be my thyroid. All right, so the thyroid anteriorly and the arytenoids posteriorly. Now we are talking about the quadrangular membrane. I have a membrane that connects the middle of my larynx to structures on the top, and I have another one that connects here to the down. So I have one that connects the middle of my larynx to the top, which is the epiglottis. All right, and that is the quadrangular membrane. And I have another membrane that connects the arytenoids to down structure, which is the cricoid, and that is the conus elasticus. That membrane is actually a membrane, intrinsic one. It connects my most important structures inside of the larynx. And you guys know that the most important structures are the epiglottis, the thyroid, the arytenoids, and the cricoid, right? So from the top, we have the quadrangular membrane. It connects the arytenoids to the epiglottis, all right, and then it connects laterally the cricoids to the anteriorly to the thyroid and posterior to the arytenoids, and you have down the conus elasticus. So quadrangular membrane up with the epiglottis, conus elasticus down with the cricoid. All right. Now, why these two ligaments are important? Because the lowermost part of the upper ligament is going to condense, giving me a very important fold called vestibular fold. And the topmost upper free border of the lower membrane is going to condense and give me a very important fold, and that is the vocal folds. So remember again, quadrangular membrane up connects me to the epiglottis, and from epiglottis down to the arytenoids, and then down we have conus elasticus, and that connects the arytenoids and thyroid to the cricoid cartilage, and that is the conus elasticus. Quadrangular membrane, conus elasticus, and we're going to talk about them into more details. So remember again that the quadrangular membrane up is going to condense, giving you a very important fold, and that is the Epiglottic Fold. It's basically the fold that connects the epiglottis to the arytenoids. Remember that we had the cuneiform cartilage embedded in that. This is in the topmost part. And the lowermost part is giving us the vestibular fold, which is very important when we talk about the internal structure of the larynx and the cavity of the larynx. All right, that is the quadrangular membrane up. And down we have the conus elasticus. And because the conus elasticus is actually connecting the cricoid cartilage to anteriorly thyroid, posteriorly arytenoids, we have other names of it based on the attachment. We have what we call the cricothyroid ligament, we can call it as such, or we can call it the cricovocal membrane, because it connects to the vocal folds, or it connects also to the vocal processes of the arytenoids. This is basically the conus elasticus. All right, so remember the quadrangular membrane was up, and that the upper free border is condensed to form an important fold that connects the epiglottis to the arytenoids. All right, here, which is very important because that fold is going to help us to close off the laryngeal inlet by the aryepiglottic muscle in that. So that is the aryepiglottic fold, and the lower free border of the quadrangular membrane will give the vestibular folds. All right, and that is regarding the upper membrane intrinsic, and regarding the lower intrinsic membrane, which is the conus elasticus or cricothyroid ligament or cricovocal membrane. All right, this is going to be the down one that connects the cricoid to the thyroid anteriorly up and arytenoid posteriorly up, and then condensation of that gives you the vocal fold. All right, another thing that you guys need to know is, yes, the cricothyroid membrane is the thin part of it, but we have condensation anteriorly to connect the cricoid to the thyroid, and that condensation is a ligament, and this is what we call the median cricothyroid ligament. Okay, so based on that, we said that we have two membranes intrinsically, one up and one down. Each one of them makes two condensations and gives us two important structures. All right, the one that's in the top gives us two condensations, one up, which is the aryepiglottic fold, one down, which is the vestibular fold. The conus elasticus or the cricothyroid membrane or the cricovocal membrane, it gives two important condensations, one on the top that gives us the vocal fold, and one anteriorly that firmly connect the cricoid to the thyroid, and that is what we call the median cricothyroid ligament. All right, now we're gonna move on, talking more into details about the vestibular fold and vocal folds. Again, this is, guys, we're going to talk about the vestibular and vocal folds as we proceed, but here, another recap with adding up one important thing about the quadrangular membrane. Remember, the quadrangular membrane was on the top, and that was coming off all the way from the epiglottic fold all the way to the vestibular fold. Remember that information? I want you guys to relate that. Remember when we talked about the extrinsic membranes? The one that the topmost membrane of the extrinsic ones, it was the thyroid membrane that was connecting my thyroid cartilage to the hyoid bone. I want you guys to know one thing. Externally, the thyroid membrane, internally, we have the epiglottic fold. In between them, we have a very important fossa, and that fossa is actually what we call the pyriform fossa. So again, this is the thyroid membrane externally, this is the epiglottic fold internally, and the quadrangular membrane. Between them, we have an important fossa, and that is what we call the pyriform fossa. And this is important because in that we get to see the internal laryngeal nerve. Internal laryngeal nerve, it comes in from the superior laryngeal nerve. It pierces the thyroid membrane externally to get to this fossa in here, pyriform, because it wants to supply structures above the vestibular fold. And that internal laryngeal nerve is important because sometimes if you have material, let's say you have a lodged material like the fish bone or thin chicken bone or something that comes into this fossa, it's very important that if you want to have excision or removal of that material, you need to make sure not to injure the internal laryngeal nerve, because that can injure this nerve. And this is why this information is important anatomically, because this fossa is having the internal laryngeal nerve, and it's an area of many exam questions. All right, so as we proceed, if you guys look at this coronal section, this is your larynx. All right, this is the laryngeal cavity. Remember, we were saying the quadrangular membrane was up, and then the conus elasticus was down, and condensation of the lower borders of the quadrangular was giving us the vestibular folds. So these are the two vestibular folds. Condensations up of the conus elasticus was giving us the vocal folds, and in between these folds you have what we call the ventricles. All right, so these are the two ventricles. This is a coronal section that shows you the laryngeal cavity. All right, and again here, this is the internal laryngeal nerve. And this is another picture that shows you guys the pyriform fossa, which is lateral to the epiglottic fold, the fold that's between the epiglottis and the arytenoids, the epiglottic fold, and inside to the thyroid membrane. This is basically your fossa. All right, and this is how the internal laryngeal nerve pierces the thyroid membrane to get to the fossa. All right. So here already talked about the conus elasticus, and we showed already how the condensation of the upper free border makes the vocal fold and ligament, and how the condensation of the anterior part of the cricothyroid membrane actually gives us, which is the conus elasticus also, gives us the median cricothyroid ligament. All right, so here back to the laryngeal cavity. As we open the cavity of the larynx, remember that, you guys, we have what we talked about, the folds. We have vestibular fold up, we have vocal folds down, between them we have ventricles. Now, why do we call it vestibular folds? Because they are lying in that area, which is what we call the vestibule. What does vestibule mean? It means the entrance. It's a wide entrance, because this is the entrance of the laryngeal cavity, and because it's a wide entrance, we call it vestibule. So this is basically the vestibule, or the supraglottic space. And then here, this is the area of the ventricles, and then down to the vocal folds, we have the infraglottic space. So these are the three areas that we have them in the inside the laryngeal cavity. Between the vestibular folds, we have what we call rima vestibuli. Rima, it's basically the space between them. If you guys look at a top view between the two vestibular folds, we call it rima vestibuli or vestibuli. And then down between the two vocal folds, we call it rima gloridis. All right. and between them again we have the ventricles. All right, so we already talked about that previously. With that, we are done with the general framework of the larynx, and see you guys in part 2. And in there we're going to talk about the muscles and their functions and injuries and so on. Thanks for watching. Don't forget to like and subscribe, and see you in part 2.